With Kenya continuing to record more and more positive COVID-19 cases, calls for the government to adopt more radical measures to contain its spread continues to reverberate. With Kenya currently on a 7 p.m., 5 a.m. curfew, calls to place the country on a total lockdown have gained currency. Calls that a section of bishops from Busia County say could be counterproductive in effort aimed at taming the spread of COVID-19, instead calling on the government to consider such a radical move only for the most affected counties.
Kwamba miji ambayo yametajwa kuwa ni hotspots, kwa mfano kama Nairobi, maambukizi mengi tunaona yako Nairobi na Mombasa. Miji hii miwili ama mitatu ndio yangewekwa kwa total lockdown. Hakuna mtu anatoka Nairobi na hakuna mtu anaingia Nairobi. Hakuna mtu anatoka Mombasa, hakuna mtu anaingia. Na government iweke msaada kwa wale wachache wenye wako kwa hiyo miji. Tutakuwa tumecontrol hii kitu.
The concerns coming as Cases Member of Parliament Swarup Mishra called for a total lockdown in regions that have recorded the highest number of coronavirus cases.
This is the right time to come the lockdown, but not whole country. To the high risk, prevalent, already prevailed and prevalent places, locations like Nairobi, Mombasa, Kilifi and so on and so forth. But complete lockdown to the country is not alarming.
Elsewhere, KBC County government has yet again slapped a raft of additional measures to combat the coronavirus. The measures include massive cleaning and fumigation of streets in urban centers and households in the sub-counties. Meanwhile, inadequate resources, healthcare infrastructure and shortage of healthcare workers in West Pokot County poses a challenge in the response to the COVID-19 pandemic. The county, which is struggling to cope up with the pandemic, has not allocated any specific funds to help in curbing the spread of the deadly disease and lacks testing kits to monitor the virus, protective clothing and equipment. According to the area governor John Lonyangapuo, county funds were recently used in paying pending bills, noting that the county is struggling to put measures in place to combat the spread of the disease.
What we have here, we don't even have for salary. So you can already see what we are struggling to do. But the little we have managed to put aside, which is going to come out because we finished the supplementary yesterday, the little that we'll be able to will complement.
The development coming as Migori County Referral Hospital recorded an upsurge of patients at the dialysis center in the wake of coronavirus pandemic. The facility has been forced to extend working hours and deploy an additional workforce in a bid to manage the high flow of patients with renal conditions. Finally, Kitui County has launched street fumigation of all major towns across the county in a bid to combat the spread of COVID-19 virus days after the region registered its first positive case. County Executive in charge of Health, Dr. Richard Munyoka, says the county will be conducting the exercise at least 3 times a week in all its busy towns.
This will be done regularly, at least 3 times every week. And we hope this will also be replicated in the other busy towns within Kitui County. One thing that we have asked the security officers is that once they finish their work, because of the curfew that is already in place, and which is very good, that they will be given time to finish the work and go home.
Beatrice Gatonyengetich, Channel 1 News.